Well, good afternoon and welcome to review and republish your DSPT. My name's Alan Wilmot and I'll be running through the session this afternoon on behalf of the Better Security, Better Care team. But before we start, we'll just wait for a few moments to ensure that everyone who's joining us has been able to log on, etc. So if you just bear with me for a couple of minutes. Okay, so let's move forward then. And before we start, what I'd like to do is to just share a few housekeeping points, because I am aware that whilst this webinar is for care providers who've already published their DSPT in the past, I also want to recognise that some of you may not have been the person who published last time. So if you do have any questions, please feel free to follow the instructions that I'll run through shortly in terms of how to get those to us. So first and foremost, attendees are on mute and can't be seen, even though we are recording this session. So in order for you to be able to have a copy, but you won't appear on the video. But please do use the Q&A function to ask any questions you have. And if you're watching on a phone, you need to tap the screen to see the controls, choose more, and then Q&A. Any questions that we can't answer, we will come back to you, I promise, if you add your email to the Q&A question. And in terms of when we'll be letting you go, the webinar will last for no longer than 1 hour, and you will get access to the presentation, etc., which will include all the links that we'll be referring to. So prior to looking at the agenda for the session this afternoon, we would be really grateful if you'd just answer a few questions for us if you are a care provider. So we're going to run a poll asking what level your organisation is currently at on the DSPT, whether you've used it before, whether you're a single site or multi-site organisation, and where you heard about this particular webinar that we're running today. So if you would just be able to respond to the poll that will come up on the screen shortly, we'd be eternally grateful. So in order to respond, obviously, it's just click on the appropriate response. And I'll just wait while people have time to read through those and complete them. And then we'll see what sort of audience we have with us this afternoon. Okay, so if everyone has now responded to the poll, see if we can see some results. Right, so none of you have published at entry level previously. We've got a few people at approaching standards. Most of you are at standards met, and even a few at standards exceeded. So that's excellent. And 75% of you have used the DSPT before. And we've got the majority of you as multi-site participants. So that's excellent. Thank you. Right, okay, that just helps me to understand who's with us this afternoon. So let's have a look at the agenda and move into the session per se. So what are we going to be looking at today? Well, we're going to start by looking at logging into the DSPT. So how do you log into the already established DSPT? And then we're going to cover aspects of reviewing the DSPT submission, looking at what's changed in the DSPT since June, and then how you actually go about republishing your DSPT before moving on to look at some tips and guidance available. What support is available is a theme that will be running throughout the session. And then we'll finish off by offering you the opportunity to ask any last minute questions and looking at what the next steps are. So let's move forward then to look at the programme properly this afternoon. So we'll start by looking at the process itself. So in order to republish, the first thing you need to do, obviously, is to log in to the DSPT, and then you would review and update your existing answers. And I'll just explain about this next box, which is complete all mandatory questions. And those of you that did complete the DSPT the first time will be aware that you were advised that if you wanted to publish at standards met, you need to complete all of the questions, not just the mandatory questions. When you republish, you will see a different view to the toolkit, and you will see all of the questions that apply to all of the organisations that complete the DSPT. So in order to publish for a social care organisation, you only need to complete the mandatory questions. And then obviously you will need to publish once you've reviewed and completed. And just a reminder that the DSPT date is June to June, therefore published by the 30th of June. And again, just another reminder that in order to keep your DSPT up to date, you can revisit it at any point during the year. It's not just, you're not just able to access it once a year, etc. So if there are areas that you are not sure of, there is lots of support available to you. And all of the support that's available is free and official. And that includes online guidance, step-by-step films, webinars, frequently asked questions. There are template policies available on the Digital Care Hub. There is a helpline, and there is also specifically support available in your local area from the 28 local support partners that are across England. And so there is national support and local support. And as I said, there are lots of resources out there to help with any of the responses to the questions, but also in terms of general DSPT aspects, etc. So let's move on to have a look at how you actually republish your DSPT. So as I stated just now, the starting point is to log into your DSPT. And you can do that by going to the web address that's on the slide there. And you log in with your email, and that's the email that was used to register with the DSPT initially, and the password. And should you have any difficulties in terms of logging in, there is again support available where you can contact the DSPT help desk on the telephone number on the slide, or you can email them at Exeter as shown on the slide there again. So when you go to the website, you click on login. This is the page that you see. So it's a standard login page. And you can see on the left-hand side there, it asks for the email address that's linked to the DSPT account and the password that was used to set up the account. And then it's a simple case of clicking on login. Just to mention the login with NHS Mail option on the right-hand side there, it is possible to log in with your NHS Mail address. However, if you log in with your NHS Mail address, it will then expect you to do that when you log in future. There is the forgotten password option available on the login facility. So if you know the email address, but you can't remember or don't know the password, you can click on forgotten password and follow the usual process in order to progress with completing and republishing your DSPT. So once you're logged in, what do you see? Well, for those of you that have registered using the V code or the single site location code, this is what you will see. And you can see at the top there is a progress bar demonstrating how many questions are already completed. And the DSPT will transfer your responses across to this particular view, unless there are changes to the question, in which case you will need to revisit that particular question. So the first task to do is to review all of the mandatory questions to make sure that you have completed against them. If there are any that have not been completed, then those are the ones that you will need to revisit. The questions, as before, are grouped into the 4 sections. And remembering that it is the mandatory questions for a social care service are the ones that you need to respond to, ignoring the rest, and enabling you to proceed to republish your DSPT. For those of you who completed using an HQ code, then it will look slightly different. and it will look like this. You can see that there is an option to view branches in the center of this slide there. So this is an HQ assessment. Publishing this will publish for selected branches, and if you click on the view branches, it will open a drop-down selection option in terms of which branches you might wish to publish for. And on the progress bar, again, it will show how many of the 42 mandatory questions have been completed, assuming that you registered as a social care service. So whether you are publishing as a single site location or a HQ assessment, it is the same 42 questions that you will need to respond to, marked mandatory. The amount of work that you need to do in order to republish will depend on what level you published at previously. And we can see on the slide here that if you previously published at approaching standards, and I see from the poll earlier on that some of you had published at approaching standards, you will need to review and update the existing answers, but you will also need to complete all of the remaining mandatory questions in order to reach standards met. You cannot republish at approaching standards. You're only able to publish at approaching standards on the first occasion. If you previously published at standards met, then all you need to do is to review and update the existing answers. So basically your task is to determine whether or not the questions are responded to appropriately for your current reality, and that all of the mandatory questions have completed written next to them. If you did publish at standards exceeded, as I saw again on the poll that some of you completed, then the task is to review and update your existing answers, making sure again that they are reflecting the current reality for your organization. I mentioned earlier that the DSPT does change depending upon what happens year to year. Sometimes the requirements are amended, or sometimes there's different perspective in terms of what the social care organizations should be doing in terms of data and cyber security. So you need to check that the current requirements are all responded to. So last year there were changes to make it easier for all multi-site organizations. So they published an additional screen which displayed to organizations not flagged as HQ but previously published on behalf of other sites in the last publication. And the existing functionality with HQ and the sites that they're publishing for is unchanged. However, where a non-HQ organization that had sites added to their last publication selects publish assessment, and this additional screen below will be displayed. So you'll see this option here that will just highlight which services have been linked to this particular publication. And then again this year they've added some new sections to the DSPT, or one new question, should I say. Question 453 is additional and new. So everyone will need to complete this question when they republish. And it asks about multi-factor authentication. It gives a bit of information about this being the most effective way to protect data and accounts from unauthorized access. And it prompts you to consider all systems that can be accessed from the internet and whether or not it's appropriate to have multi-factor authentication linked to those particular accounts, etc. And again, as with lots of the questions within the DSPT, there is guidance on implementing multi-factor authentication. And that can be found on the Digital Care Hub if you're not sure what this is, etc. But I will just run through a few elements of that. So why have they included a new question on multi-factor authentication? Purely and simply, it's about enhanced security. It's a way to make your online accounts much safer by adding extra steps to prove that it's really you that's using the account. And that's usually a text message, email code, fingerprint authenticator app, such as Microsoft, etc. But most of you will be familiar these days with MFA approaches and the sorts of things that you will have used it for, I suspect, are online banking, etc., etc. So what is this question actually asking of your organization? They're asking you to take several steps, really, to review your current systems, speak with your suppliers to determine what the security arrangements are, identify any potential issues, such as staff sharing devices or logins, the usual sort of issues around cybersecurity. Identify those areas where implementing MFA might not be appropriate. So, for example, if there were already other significant controls in place, so depending on your particular systems, etc., it may not be appropriate because you've got other security measures there. So it's about deciding on your organization's balance of security versus usability, and noting any elements where you may not have the appropriate measures in place. So it's important not to go overboard. Systems need to be usable and we don't want to put people off using them, etc. But you do need to identify the appropriate level of security for each system that you use based on the nature of the information that it's holding and that you need to protect and uphold the rights of the people who use your service, etc. So you may also want to consider how risk averse your organization is and whether you're prepared to take chances, etc. But where appropriate, MFA should be implemented for all individual logins to the systems. And if you're not sure about it, again, there is the local support organization available to support you with that. Your software suppliers will probably be able to help. And certainly if you use an external IT supplier, they will be able to support you as well. So it's about using it where it makes sense. So in summary, you need to log on to your account. You need to review the questions and responses. You then need to complete any questions that haven't been completed before moving on to then publishing your DSPT. So let's just have a quick look at the process that's required. So it's log on, review and update your existing answers, complete all mandatory questions, and then make sure that you publish by the 30th of June. So quick reminder of how that works. In order to respond to a particular question, you need to click on the blue text, which will then expand the question. But remember that you only need to respond to the mandatory questions. And on the slide in front of you, you can see that there's one question there that isn't mandatory. Therefore, you can ignore that entirely. So having reviewed and update your existing answers, in order to review and update your existing answers, you click on the blue text and it will open the question, in which case you'll see the question itself, some explanatory text or tooltip, which gives you your best practice advice. And that's really telling you what you as an organization need to do in order to be able to affirm against this particular question. And I will just mention the comments section here. This particular question is a tick box. So all you need to do is to check the box on the top left-hand side of the question. But the comments section can be really useful, especially for your colleagues and future publications, etc. Because if you just make a few notes in there, if it's not you publishing the next time by the 30th of June, it can give some context in terms of where information is or where you're at with a particular aspect of your data and cybersecurity. So you would respond by either ticking the box, entering the text, etc. And as I've said, use the text box just to provide some information in terms of context for whoever looks at the DSPT in the future. So again, a quick look at the process in terms of how that works. Login, review, update, complete mandatory questions, published by 30th of June. And again, a reminder that you can keep your DSPT up to date at any point during the year. So if you change, for example, from paper records to digital social care records, and that then has an impact on one of the responses to the questions, you can revisit the toolkit and keep it up to date, so the republishing process becomes even easier. So having completed all of your responses, you would then scroll to the bottom of the page. And for single publications, it would just say publish assessment, as we see on the screen here. And remember that your DSPT status will be published, not your full report. So all that anyone will see when they click on the DSPT entry on your particular service is that the date it was published, the level it was published at, and whether it's current, etc. So the responses are only visible to you or people within your organization. If you were an HQ publication, so you published on behalf of a number of sites, it would look slightly different. So it would look like this. And you can see that at the top there, there is the opportunity to view the branches that are linked to this particular publication. So you would just click on view branches. Again, the list would drop down and you can select or deselect services that you wish to be attached to this particular publication. Bearing in mind that in order to publish on behalf of more than one service, you have to check that they have the same policies and procedures, same IT systems and data security arrangements. And if that is the case, then you can publish in exactly the same way. Should you receive a screen that looks like this, it would indicate that there is some problem with one or more of the questions. So it could be that you've missed a particular question, or you've entered the response to the question in the comments box, not the text box, therefore the system hasn't recognized it. But this screen will show you where the problem lies. So you'll be able to click on the red text and it will take you to that particular question and you can amend whatever the issue is. So you'll then again click on publish and you will receive an email notification which confirms that you have published and the level that you've published at, etc. And that will then, you can then use that in order to demonstrate to anyone within your organization or people like CQC, etc., that you have published. So the process is fairly straightforward and fairly simple. So just to summarize, let's have a look at some useful information around using the DSPT, etc. So it is possible by using the admin tab. So when you first log in, there will be a toolbar across the top of the page, and on the right hand side of that toolbar there is an admin tab, and if you click on the admin tab it allows you to manage access to the toolkit. So as an administrator you will be able to manage users, so who has what access. You can add and edit evidence, you confirm evidence and publish. So it's possible to set up people as members of your DSPT, which would enable them to add or edit evidence. And the way in which I've seen that being used in the past is, for example, on the IT section, if you wanted your IT support to respond to the questions there, you could add them as members and they will be able to add and edit evidence to the IT section. Or it's possible to add a member as a viewer, which means they can look at the DSPT, but they can't change anything. So it's also then possible, once you've published your DSPT, to access the questions and responses. And it is possible to download it as an Excel file. So if you click on download assessment, the Excel file will download into your device straight away. Or indeed, you can save it as a PDF file, in which case, in order to get to the PDF file, if you look at the top of the staffing and roles section, there will be a link set that states view previous publications. So if you click on that link, it will then show you what's on the left-hand side of the screen, and all of your publications will be listed. So you select the publication that you wish to save as a PDF, and you click on view details. And just by way of a reminder, this is also where you can download your certificate. So just under view details for that particular publication is the link to download the certificate to demonstrate that you have completed that. So to save your published DSPT as a PDF, click on, Control P to save as a PDF, and then click on Save rather than Print on the screen that comes up in order to save it as a PDF. However you choose to use the toolkit publication, I would suggest that it can be quite a powerful way to reinforce the organization's response and expectation around the rights of the people that you support and employ. So if you have more than one site, I would suggest you need to tell your branches that you have published the DSPT on behalf of their particular service. So tell your registered managers. I've come across a number of registered managers asking for support to publish the DSPT, only to find that the HQ has published on their behalf and they weren't aware. If they're not aware that you've published, they're probably not aware of what you've stated within your DSPT either. Do make sure that you download your certificate to prove your DSPT status. You could add DSPT status to your website to reassure people that you are serious about protecting their personal confidential information. Increasingly, it's becoming useful to include in your bids. So tell your commissioners, including the ICS, tell your NHS partners, your IT suppliers, etc., because it's all about confirming that your organization is serious about data security and cyber security. So if we then have a look at some tips around completing your DSPT, as I stated earlier, you can revisit the DSPT at any point throughout the year, which makes it easier to republish and keeps it current and up to date. Ensure your managers and staff understand what's expected of them around data and cyber security, and make sure that your managers can access the information in order to be able to ensure that when they carry out their service audits, etc., they know what it is they should be doing and how they should be doing it. But above all, please remember that you're not alone in this whole process, that there is lots of expert and friendly support available out there. So there is a full program of support, again, that's free and official, that it is local to you as well as national, and you can access it by any of the means that are available, and the links are on the slide there to help you with that. And then for each of the areas within the toolkit, there are guidance and templates that are freely available to you. So for approaching standards, there's a whole range of policies there to support and help you with that if you find you don't have any of them, or just want to compare your existing policy with a sample from Digital Care Hub. For standards met, there are some additional required policies that you can see on the right-hand side of the slide there, including the national data opt-out and business continuity planning around data and cyber security. And then there is templates around the recommended documentation, which is around incident reporting forms, a mobile device assignment form, smartphone policy templates, and a template suppliers list. So whatever, in order to respond to the questions within the DSPT, there is a corresponding resource available to help you to be able to comply with the requirements and to respond to the DSPT. So if after all of this you felt that you did need further guidance, the Digital Care Hub covers all things digital, all things data and cyber security. And as you can see on the slide here, there is a whole range of different resources available to you. So that relates to the staff and workforce, and that includes digital skills and training resources that are free to access and use, guidance on managing your software suppliers, information on document retention and disposal, information on best practice around your security. And then in relation to the increasing issue of mobile devices, etc., there's information on protecting those devices as well as, again, the national data opt-out information there. But always remember that there are people there, so you can contact the Better Security, Better Care local support partner, or visit the Digital Care Hub website in order to access the information that you need. So the process of republishing is not complicated, and there is support available to you. So just once again, there are the 28 local support partners across the country who can offer one-to-one webinars, phone support, etc., etc. For large care providers, there is support available on the phone number there, or from the help desk at Digital Care Hub. And if you get any technical issues around the DSPT, there is the National Exeter Helpline available. And the Exeter Helpline email address was in an earlier slide, as well as the phone number there. So I think at that point, it's appropriate for me then to ask if there are any questions that haven't yet been responded to. So I'll open it up to see if there's anything coming through, either in terms of things I haven't covered or issues that it might have raised for you.
Okay, yes, yeah, we do have one question.
Okay.
I'm not sure if this is something that we might need to take back to the DSPT team, but worth asking now. Person says, with regard to the new edition of the question 4.5.3, multi-factor authentication, is enforced on all remote access and privileged user accounts on all systems, with exception, scroll down, sorry, with exceptions only as permitted. They said that there was some discussion here and clarification requested in terms of the remote access. Some people read that as, oh, sorry, it keeps scrolling far past the question.
Okay.
Some people read that as you only need MFA when off-site and accessing internet-based systems, for example, working from home or away from headquarters, while others read it as multi-factor authentication always being required if you're accessing any internet-based or externally hosted systems, irrespective of your location as an employee. Are you able to clarify that just now?
My view on that is that it should be regardless of where you're accessing. Okay. In the same way as if you log on to your personal banking app on the phone, it will always ask you for the multi-factor authentication, whether you're at home or whether you're out and about, etc. It just ensures that the connection is always secure.
Lovely, thank you for that, Ellen. Another question here in the chat section, and please can I just ask everyone if you're able to use the Q&A section instead of the chat, that just helps us so that we don't lose track of your questions. But just another question here, training for CRO, so SIROs, Caldecott Guardians, IG leads, or other specialists having dedicated training in their respective roles, is there an expectation on how often refresher training should take place? Is every 2 years sufficient? Otherwise, the expectation would be to repeat the same course annually, question mark.
Right, so two different answers, I suppose, from my perspective. Everybody should be receiving refresher training on data security and cyber security on an annual basis, I would suggest. However, if you are fulfilling a specialist role, such as CIRO or DP officer, there's no specific requirement, as far as I'm aware, in terms of how often that should take place. But I would suggest that if there is an expectation that there is annual refresher training for all staff, then if you are fulfilling an additional role, a specialist role, then the expectation would be that if there is anything changed or new, that should be part of a refresher training again, and it should be reviewed on an annual basis as part of your training needs analysis that you are required to undertake as part of the DSPT.
Yeah, that sounds about right. And also considering, just to add on that the DSPT is to be renewed yearly, it would ask that your 95% of your team have had that training, and that it's going to ask you that yearly anyway. So yeah, just to tag that on. A couple more questions here in the Q&A section. So I'll just is there still a requirement for an external auditor to conduct an audit on our answers? If so, can evidence be dated from any time between the 30th of June 24 to the 30th of June 25?
There's no requirement, as far as I'm aware, for any external audit on your responses to the DSPT. It is a self-assessment within your organisation. So as far as I'm aware, no one has access to the DSPT unless you give them access.
Yeah, that's about right. I'm not sure if you're maybe referring to CQC when they want to see how you evidence your data protection, but again, that's not considered a requirement of an external auditor, but it is best
No,
practice.
no, and certainly
recommended.
CQC would. I've never heard of CQC asking to see a DSPT
Yeah.
response.
Okay, so I've clicked answer live on that. And then one more question, are either multi-factor authentication app? This person says, I shadowed the senior earlier and they appear to struggle to sign into their care plan app due to lack of network. If I enforce this, will this make things even harder?
If they're experiencing lack of network, and you're using an app in order to access care plans, etc., then I would suggest that that needs to be reporting to whoever the organization is, in terms of it potentially being a data breach, because if you're not able to access the information that you require in order to provide the support, then strictly speaking, that would be considered a data breach.
Yeah. Thank you for that, Alan. And that's the end of the questions there. So I'll pop my, oh wait, just one more.
Okay.
Oh, the person's just responded to say that they've reported this to their ICB.
Right. Yeah. Good. Yeah, because if you're not able to access the care plan, you're not able to provide the support that you're being contracted to provide, etc. So it actually becomes debilitating in terms of the service overall.
Yeah. Yeah. And I suppose that if you're having network issues to access the app, then I mean technically, oh, two more questions just popped in. Then it would be a little bit more difficult because you're struggling with the network anyway, but it doesn't change the fact that MFA is important for protecting data. Another question here. So I think I think someone's just responding. Sorry, I think it depends on an organization category in terms of external audit. Okay, it's just a response to the earlier.
Oh, okay.
As a category 3 type organization, I don't think that there is a requirement, but I've heard of them for NHS trusts and ICB,
right.
etc. level
Yeah.
1 rules.
Yeah, I was responding on behalf of a social care organisation.
Perfect. And then just one more come in just now. In regards to the above question about an external auditor, evidence item 9.4.5 requires that someone independent audit your findings.
I'm not sure that's a mandatory question.
Yes, I'm not sure either. I have a little look and then pop in.
Yeah, I think that might be a question for a non-social care organisation.
Yeah, I'll have a little look at that as we continue and then respond to
Yeah.
that as well, just for clarity for you. And then just another one popped in. Any tips in regard to conducting a DSPT if it's your first time being given the responsibility or taking on the responsibility?
Right. Assuming that you've been asked to do it, then I would suggest that you need to have access to either your information governance lead, who should take overall responsibility for this. So if you don't have the official roles of data protection officer, etc. So whoever is your information governance lead should be able to respond to any questions you have and be able to guide and advise in terms of responding to the questions appropriately initially until you find your feet in terms of where everything is and how it all works, etc. But do take advantage of the digital care hub resources that are available. So if you have a particular area that you're not sure about, generally speaking, on the digital care hub, they will have information that will help you to understand what's being asked and how to respond, etc.
Yes, exactly. For like all of the questions on the DSPT, we've got a guide or a resource or a template policy. So everything that you need is all on the website and it's all 100% free. And we also have local support organizations around the country, of which Alan is a part of one, and fantastic. And they all work really hard. They provide free support. You can contact them. I'll put in response to your question, oh, actually, I'll put it into the chat so everyone can see it, a link to the LSO page so that you can all find your LSO for your region as well. And they provide free in-person support or webinars, or it's pretty personalized. So I'll pop it in for you just there as well.
And just to follow on from that, if your difficulty with completing for the first time may be just technical issue in terms of actually completing it, your local support team will be more than competent and able to help you to work through that.
Absolutely. And that's the end of the questions there for you, Alan. So I will just find the response to this question about 9.4.5 and I'll update that for you, but I'll put myself back on mute now.
Okay, so if that satisfies all of the questions, what we'd like to just finish with is one last request in order to complete a poll, again for care providers. Just a few questions around the impact the session might have had on your confidence in reviewing and republishing your DSPT. But also, how likely are you that you will complete in the near future? And how likely is it that you might contact your LSO, etc.? So if you wouldn't mind just responding in the same way as you did earlier, that would be really helpful in terms of informing our future sessions, etc. Okay, so once people have managed to respond to all of the questions, we'll have a quick look at the outcome in terms of the poll. So 83% of you feel more confident in terms of completing and republishing your DSPT. That's excellent. 11% fairly confident anyway. 6% say you've made you more anxious. That's slightly concerning. In terms of who will republish the DSPT, 78% more very likely to do it in the near future. Unsure 6%, likely 7%. And in terms of whether or not you'll contact your local support organisation, we have 61% who are likely to, 22% unlikely, and 17% is not applicable to. So thank you for that. And in terms of whether you would recommend this webinar to your colleagues, 100% of you would. So 100% of you would. That's really encouraging. Thank you very much indeed for that. So that then brings us to the end of the webinar, unless Rihanna has a response to that particular question.
Yes, I had a look for it on the demo toolkit, which I have access to the social care view, and I can't see a question 9.4.5. So it's possible that you have not entered the social care view. So I would say to go back to your pre-registration for your DSPT and just make sure you selected the correct view, because there's a DSPT for many different sectors, and it could be that you've chosen health or like dental or something similar to social care, but not exactly the right DSPT for your sector.
Yeah, although it may be worth checking that if you are republishing, that the particular question you're looking at has mandatory next to it, because it's only the mandatory questions you need to respond to when you are republishing.
Yes, yeah.
Thanks, Rihanna.
Thank you so much, Alan.
Okay, so if that answers all of the questions for you, can I thank you all for putting up with me this afternoon? Wish you the best with republishing the DSPT, and we're going to end the webinar there and allow you all to go back and get a cup of tea or something. So thank you all very much.
Lovely. Thank you so much, Alan. Take care, everyone.
Cheers, Alan.